Hi, everyone. My name is Marilyn Biding. I'm from Alameda County's Healthy Homes Department, where I am the community outreach nurse and nurse case manager. Today, I'm here to present to you about a refresher in regards to lead poisoning. We're going to be highlighting lead poisoning prevention in children and the importance of screening and testing. So we are going to go ahead and go to the next slide. Perfect. So, to give a little background about who we are as a department, we are Alameda County's Healthy Homes Department that was established in 1991. So, we've been here for a while. This is where the Childhood Lead Poisoning Prevention Program is housed, along with other Healthy Homes programs that we offer. We combine health, housing, and environmental services under one umbrella to help reduce residential hazards for our community. Now, given that we're the Healthy Homes Department, what in fact do we consider a healthy home? It's a home that's designed, constructed, maintained, and rehabilitated in order to optimize health. Ultimately, we're making sure that it's a safe space. Now, what's an unhealthy home? It's shoddy, poor construction, poor design, insufficiently maintained, and can potentially lead to health complications or injury. An unhealthy home can have a variety of hazards. These are the 29 housing hazards that we assess for. We can provide general guidance. However, our services are currently limited to lead poisoning prevention primarily. Now, this brings us to what we're here for today. Our objectives are to go over the basics of childhood lead poisoning. We'll talk about the scope, risk factors, clinical effects, and the management. We're going to discuss cultural risk factors and socioeconomical groups that may be at higher risk. We're going to review California statutes, mandates, and regulations when it comes to screening and anticipatory guidance. We'll also highlight both health and environmental interventions that can support lead poisoning treatment. And lastly, we're going to discuss services that we can provide to both support our patients and you. So let's dive in. Can you tell which child has lead poisoning? The interesting and unfortunately scary thing about children with lead poisoning is that they often have no symptoms. Therefore, early identification is key because children don't look sick. Now, this goes into the scope of the problem. We want to highlight that lead poisoning is one of the most common and preventable environmental diseases in California children. There are no known safe levels. Ideally, when we see test results, 0 is best. And if we emphasize the importance of prevention, we can protect children from not being exposed. But if we do our due diligence and screen, we will be able to know who is affected. There are certain populations that are at higher risk for lead poisoning. First and foremost, infants and toddlers, because they put everything in their mouths. Those living in homes built before 1978, because we want to take into consideration housing sources of lead, soil, water, paint. Individuals living outside of the US that could be exposed to environmental hazards or cultural sources. And lastly, we want to take into consideration individuals who work with lead. Not only are they actively exposed at their work site, but there are chances that they could be bringing lead home from their clothes, the shoes, even the car, if they're not taking necessary precaution. Lead poisoning can wreak havoc on the body, and the effects from it start to be more noticeable when a child starts going to school. It can do a variety of things. It can cause damage to the brain and nervous system. It affects growth and development, can lead to learning and behavior problems, or problems with hearing and speech. This therefore leads to a lower IQ, decreased attention span, and underperforming in school, which again addresses the importance of detecting lead poisoning early on in order to start early intervention. Rascal is our statewide surveillance and reporting system. Our department receives all results that are above 3.5, and based on those results, we provide our case management services accordingly. Now, for results that are less than 3.5, we do recommend annual screenings during well visits. You are welcome to notify our department of your patient's lead levels. This is an example of our form that you could complete and fax back to us. It's available on our website, or if you contact our department, we would be able to email it to you, fax it over to you, so that way you could always have your copy. And here comes another interesting part. Of these items, which do you think have lead in them? As you can see, these are items that we might already have in our household. We have toys, foods, handbags, plates, makeup, chalk. I probably have all of these in my house. But to answer our original question, all of these items could possibly have lead in it. The reason why is because lead is in items for a lot of reasons. It makes products heavier, it makes them look brighter, it stabilizes or softens plastics, and it makes things more flexible so it can go back to its original shape. So, what we're going to do now is address different sources of lead. Ultimately, there are housing sources, and as you saw in the previous slide, non housing sources of lead. So we'll start off with housing sources of lead, which we're still finding in some of our cases today. I think the main lead source that people are familiar with is lead paint. Lead paint is more often found in pre 1978 homes. The reason why is because this lead paint was used to speed up the drying process and it helped increase durability. Now, lead dust, on the other hand, is produced from lead paint. So, when paint gets older, it can be damaged by moisture or friction if it's disturbed. Now, when the paint peels and cracks, we can get lead paint or lead dust, or lead paint chips or lead dust. Now, lead dust is unfortunately not visible to the naked eye. It's very fine, but we should be mindful of a few places in the home. Windows, window sills, doors and door edges, stairways, cabinets. These are all areas where lead dust can accumulate. And again, we don't see it as easy to the naked eye. If our families are dealing with lead paint or lead dust, we want to advise them to remove the source with the help from a lead safe certified contractor. Now, unfortunately, we can't recommend specific contractors, but we do have a running list of certified contractors that families can pick under their own discretion and research. We also recommend to use barriers and block the areas where you see peeling paint. We recommend to clean all surfaces covered with lead-based paint, clean items that children are using often, whether it's to play or to eat. And then lastly, one of the easiest things that people can do is take off shoes before entering the home. That way, whatever you are walking outside on isn't then trucked into the house. These are some of the licensed lead hazard repair contractors that meet our minimum requirements to participate in our program. But we do advise clients to verify all information, licensing, and certifications to make sure that they are all in current and good standing. Water can be another source of lead. Historically, with the cases we have worked with, water has not typically been the primary culprit, but we do know that the recent news from OUSD that this may be a topic that providers may get more questions or concerns about. OUSD school officials are working directly with certified staff and contractors for remediation. However, just that way everyone knows there has been school letters that have been given to families addressing the issue and recommending testing for those who have been affected. So there may be an uptick in blood lead testing requests, and we would absolutely recommend that providers do order it for children, especially with the discussion regarding lead in the OUSD schools. Now, if families are ever worried about their own water at home, we always advise them to reach out to their service provider. But what they can do for themselves at home is to use cold tap water for consumption. This handout is part of our educational packet that we provide to our case managed families addressing lead in tap water. Just wanting to show you guys for reference. East Bay Mud is the water service provider that covers majority of the cities in Alameda County. They continue to prioritize removing lead bearing materials and perform corrosion control wherever there may be leaded pipes that they are aware of. East Bay Mud even goes above and beyond, even more because they also provide a free annual program to test water for lead. So, the way this program works is it's called their lead voucher program, where the occupant is testing the water themselves. So East Bay Mud sends a testing kit to the home. The occupant tests the water themselves, and once complete, they simply mail the kit back to East Bay Mud, and that's kind of it. East Bay Mud contacts them for follow up, and it's something that can be done every year if the occupant chooses to. But again, just highlighting historically, water hasn't been a culprit, but families in their homes can definitely test the water themselves if they are concerned. This is just showing our other water services here in Alameda County. They also perform routine testing and have programs as well. Lead in soil. Lead is a naturally occurring element in the environment, so we can find it everywhere. But we may find higher levels of lead within soil due to two different factors. Leaded gasoline was the gas to get in the 1920s. And although it was banned for automobile use in 1996, it's still an atmospheric environmental hazard. So the air emissions coming from the vehicles are going from the air and into the soil. And even though it's years later from banning leaded gas, that lead in the soil did not go anywhere. It's still there. So we especially have to take into consideration soil that are closer to streets and freeways. Lead paint and lead dust is the other factor to take into consideration. If there are buildings that have lead paint on them, maybe some deterioration or renovation happening, that's ultimately creating potential lead hazard within that area. We can look at lead dust like glitter. Once it gets everywhere, it's everywhere. And it's not so easy to clean up. So, again, once it's in that soil, it's still going to be there. As we mentioned in the previous slide, leaded gas started in the 1920s because it was thought to improve engine performance. Leaded gas became the standard, even though they knew lead was poisonous and those who worked closely around it could be at risk. However, researchers believed that the general public wouldn't be affected by their low levels of exposure. They were greatly mistaken and learned that lead exposure caused havoc to the body. They also found out that it can easily contaminate air, water, and soil. Unfortunately, it did take decades for scientists to learn about the damage that leaded gasoline caused, but at that point, mostly all gas had lead in it. In the 1970s, the EPA started working on phasing out leaded gas by making new vehicles that ran on unleaded gas. They were even making the cars in a way where they couldn't run on leaded gas at all, or else it would destroy their catalytic converters. By the 1980s, most of the gas used in the US was unleaded gasoline. It was more expensive than leaded gas, but it was so much safer. Thankfully, by 1996, the EPA banned the sale of lead gasoline for on road vehicles. So, leaded fuel is still available for vehicles like planes and farming equipment. Aircrafts that operate on leaded fuel is the largest remaining source of lead emissions into the air, about 50%. Specifically, piston engine aircrafts. They use aviation gas for their engines, and these are typically small aircrafts that carry about 2 to 10 passengers. Those that we would be concerned about for lead exposure due to aviation gas are those working at or near airports and children who may be living or going to school near airports as well. Because again, it can be in the soil. So again, once it's in the soil, it's always going to be there. Thankfully, the EPA does understand the dangers related to aviation gas, that they are making steps towards addressing lead pollution. So, how can we limit our exposure to lead in soil? Number one, and again, one of the easiest, take off your shoes before going into the house. We'll also recommend that kids avoid playing in soil. Sandboxes would be a better option. covering up bare soil by planting grass or mulch, and then also growing fruits and vegetables in pots or elevated garden beds versus directly into the soil. A risk assessment is done to find out if any lead hazards from soil, water, or paint is present in the home, and from there provide recommendations on how to address the hazards. Thankfully, our program can perform risk assessments for our state cases. So we talked about the housing sources of lead. Now we want to talk about non-housing sources of lead. And something to note is that nowadays we are seeing non-housing sources to be more often as the culprit to lead poisoning. Lead can be found in dishes, pots, and water crocks due to the glazes or the paint used. The reason for this is because glaze makes dishware smooth, shiny, and helps brighten up colors. But you unfortunately cannot see lead in glaze or paint. Dishware needs to be manufactured under very strict regulations to ensure that it can be used for eating and drinking. Now, if it's not under strict regulation, there is a likelihood of leaching happening. So, acidic foods like salsa, citrus fruits, and salad dressings, or let's think about beverages, orange juice, sodas, coffee, tea. These foods and drinks, they leach lead out of dishes much faster than non-acidic foods. Also, when you start to see dishes get worn out and old, there is a higher likelihood of leaching happening too. So with these type of sources, ceramic dishware that we would recommend for you to look out for would be imported and highly decorated traditional dishware. Dishware that is old, worn, chipped, or cracked. Also avoiding dishware sold by street vendors or at flea markets. As of now, the FDA has laws about lead in ceramic dishware. California specifically has a law that requires ceramic dishware that has lead to have a specific warning label stating Proposition 65. Lead can be found in food and spices for a variety of reasons. For example, spices can be grown in countries polluted by leaded gasoline. Lead dust can occur from the grinding machinery when the spices are grinded up. Also, is in items to enhance color or increase weight. Lastly, ink from plastic or paper candy wrappers that can contain lead, therefore leach into the imported candies. Unfortunately, we are unable to tell if a food or spice has been contaminated with lead by looking at it or tasting it. So, what do we recommend? To avoid imported foods and spices. Some countries have poor regulatory control, which consequently impacts the safety of food supplies. We also recommend to buy fresh locally rather than online or overseas. And then lastly, check labels. We want to see if there's a state or federal agency safety label to ensure safety. Lead can be found in cosmetics, ceremonial powders, and traditional folk remedies, especially those that are imported or purchased from unregulated sources. Lead may be found in some products because in some cultures, metals actually seem to help with some health problems. Or just like with food and spices, it's from grinding machinery. It helps with coloring and just how the product is prepared. Two of the most common products that are known to have higher levels of lead are Sindor and coal. Kohl is also known as Surma or Kajal. It's a cosmetic that is very popular in Asia, Africa, and the Middle East, and can be used for a variety of reasons. So, religious, cultural, or even medicinal. Kohl has been used to treat skin infections, while on the other hand, Sindor, and you'll see it more often in India, it's traditionally used to indicate marital status in certain religions. Common examples that are often in Latino cultures are Greta and Azarcon. These items are used for upset stomachs, constipation, diarrhea, and vomiting. So, what do we recommend families? We advise that you always wash hands after handling any of these products. to never use Sindor in or with food. And then lastly, if you can do your best to keep these products away from children. Toys. Lead can be found in the paint, the metal, or plastic parts of some toys and toy jewelry. We specifically want to point at antique toys and collectibles. The reason why lead is in these items is because it softens plastics. So then that way things are more malleable and flexible. We recommend to families to pay attention to toy recalls. Also, if there are toys that seem to be deteriorating, then we like to say, when in doubt, throw it out. Also, avoid toys from gumball machines and dollar stores. These places is where they sell more cheaply made toys that often have traces of lead in them. Lead can be found in jewelry because lead has been used to make things heavier, brighter in color, and soften plastic just like they do for toys. They are often found in discount stores, department stores, gift shops, or even vending machines. Our department has a lot of experience in testing brass items, which a lot of those items come back testing positive for lead. Typically, pure gold or silver has been a better option for jewelry if families choose to wear them. Occupational lead hazards. You cannot see lead, but a worker can bring lead home on their hands, face, work clothes, shoes, or even a car. So, people we would need to take into consideration are those who repaint old houses, work with battery recycling, welders, even those who do pottery. We do want to advise that those who work with lead hazards that they wash their hands before eating and drinking, avoid touching their face while working with leaded material, and then even changing the clothes and taking off shoes before going into the home. If some families do have a garage in their house, sometimes recommending that they change in the garage before stepping into the house and then going straight upstairs to take a shower. Our program primarily focuses on children with lead poisoning. However, as discussed, adults can in fact get lead poisoning as well. All adults, including those who work with lead, those that are pregnant, lactating women, are supported by the Occupational Lead Poisoning Prevention Program. In this program, they'll provide guidance, recommendations, and investigation of the workplace if that is where the exposure is coming from. Hobbies associated with lead can also touch a little bit on occupational lead hazards because what people do for jobs, some might do for hobbies. So, on top of the occupations we mentioned in the previous slide, we also want to take into consideration people who fish, hunt, work on DIY projects of old furniture, or even gardening. And we want to advise these people to do the same things. Take off shoes before going into the house, as well as their clothes. Again, if you have a garage, change there, run upstairs to take a shower after. Wash the clothes that they use separately from their normal laundry. But even as simply as making sure the supplies used for these hobbies are not at reach for children. Based on the number of families we case manage, we frequently see patterns of lead sources in relation to race and ethnicity. Now, this isn't necessarily 100% of the time spot on, of course, due to a number of circumstances, but it does give us some clues of what questions to ask when interviewing our families. In relation to lead poisoning, the state defines screening as getting a blood lead test. And to assess is to simply ask questions. Now, of course, we'd like to emphasize that it's more of an effective approach by, of course, doing both. This gives us more information on potential lead exposure and can give us a better understanding of how often we should recommend testing. CDPH requires healthcare providers to inform parents and guardians during each well visit from 6 months to 6 years old the following anticipatory guidance: the risk and effects of childhood lead exposure. Number two, the requirement that children in Medi-Cal should be blood lead tested. And lastly, the requirement that children not in Medi-Cal, but who are at high risk of lead exposure, should also be lead tested. But unfortunately, our program wants to make clear that this isn't enough, and we're going to explain why. So the mandate states that all children who are in programs such as Medi-Cal or WIC are required to get screened. So in the previous slide, screened means a blood test, but only at 1 and 2 years old. This is the bare minimum because we had addressed earlier that the population we are largely concerned about are children. If we are only required to test at 1 and 2 years old, then that leaves so many children falling through the cracks after that. Lead poisoning is detrimental to a child's body, and if we're not testing them after 2, then so many more children will be suffering and we won't even know it because they don't show symptoms. Remember that the way you get lead poisoning is by putting things in your mouth, and that does not stop after 2 years old for a lot of kids. Now, for the mandate for children who are not in programs like Medi-Cal or WIC, the only requirement is to assess, so ask questions. But the only question that is required to ask is again at 1 and 2 years old, which is, does your child live in or spend a lot of time in a building built before 1978 that has peeling or chipping paint or has been recently remodeled? If their answer is yes or I don't know, then order a blood test. Unfortunately, our program doesn't love this mandate either because, again, children are falling through the cracks. Leaded paint is definitely a source of lead exposure, but we discuss so many other sources of lead as well, specifically non-housing sources, spices, toys, ceremonial powders, and more often than not, our nurses are identifying these as the primary sources these days. More back in the day, it was maybe more so housing sources we've seen, but now, yeah, we're seeing non-housing sources. So the fact that this is the only mandated question required to ask, it's ultimately meaning that we're not getting all the information that we possibly can. Our department's goal is to leave as many stones uncovered, and ultimately these mandates that are in place are okay, but we want more. We at least recommend adding a venous blood lead test to annual well visits for all children, no matter if they're in publicly funded programs or not. We don't have to test so often, but at least keeping an eye out on it every year would be a safer bet versus just stopping at 2 years old. Capillary versus venous testing. Our department wants to push venous testing as much as possible. The reason for this is that capillary testing can be very deceiving. We've experienced a number of times where a capillary test results in a really elevated lead level, like 30. But then when you follow up with a venous test, it's actually not elevated at all. It shows a 2 or even a 1. We like to describe our department as small but mighty, but because we are a small department, we don't have the capacity to provide every single case the same amount of case management services. So we want to be able to direct our services to patients and families who are in real need of our care and support and who are really suffering from lead poisoning. So again, keeping in mind that if we see a capillary test of a 30, we're throwing all of our resources at them. And then when we find a follow-up venous test at a 2, we're realizing they didn't need all of this assessment because it's actually less than 3.5. However, we do understand that capillary testing may be more accessible because you may already have patients in the office, and getting them to the lab can be an issue. So we do recognize that there are obstacles that prevent a venous testing to happen. This is a copy of CDPH's management guidelines for healthcare providers. We will often send this to you for reference once our team have started our case management services. This will show testing recommendations based on their lead levels. And of course, the higher the level, the more evaluation and testing may be recommended just to cover all of our bases. The way our case management services work is based on the patient's lead levels. Starting off with basic cases, these are patients with lead levels between 3.5 to 9.4. I know it says capillary or venous, but again, we want to emphasize that we want to push venous testing always. Um, Now, when it comes to basic cases, our community health outreach workers will reach out to these families to provide lead education and recommend follow up venous blood lead testing. These cases will continue to be followed until their levels drop below 3.5. For patients who are below 3.5, they are not considered a case, and we don't routinely provide case management services. However, we are still open to provide lead education to any client you as a healthcare provider refer us to, and we'll at least do our due diligence and provide lead education over the phone. Our next tier would be our potential cases. These are cases with lead levels between 9.5 to 14.4. Our community health outreach workers cover these cases and they reach out to families for interview, complete a home visit, and they also, during this home visit, collect non housing samples. They provide lead education, recommend follow up venous blood lead testing, and will continue to follow these cases until their latest levels are below 3.5. And then we move up to our full state cases. These are cases who got a single venous level that is greater or equal to 14.5, or they got two lead tests that are greater or equal to 9.5. The second test typically has to be a venous test. When it comes to full state cases, these are assigned to our public health nurses where further case management is done. Number one, the family will get a home visit from the nurse where non housing samples are also collected. They will also get an environmental investigation. This will be completed by one of our environmental professionals or a registered environmental health scientist. Our nurses will perform a nutrition assessment. The reason for this is because nutrition is a huge factor for a lead poisoned child. So we want to see what the child's current habits are, what they're eating during a typical day. From there, we try and figure out ways to encourage better nutrition in order to combat the lead. A growth and development assessment is completed by our nurses as well. Specifically, we're using the ASQ3. We know that lead poisoning affects a child's behavior and development, so it's important for us to see where they are. Also to note, the ASQ3 results are always shared with the child's primary care provider. And depending on the score, we offer interventions and activities the family can do at home. Also, we submit referrals to community organizations such as Regional Center or Alameda County's Help Me Grow program, as long as it's applicable. We provide ongoing communication to a multitude of parties. Of course, the family, we talk about case progress, follow-up testing recommendations. We identify the lead source and ideally figure out how to eliminate the exposure. We talk to healthcare providers such as yourselves to recommend follow-up testing dates and any other needs the family may be in need of. We lastly talk to the environmental professional to review any housing sources that may be identified, and we talk about how to either eliminate or reduce the hazard. Lastly, we provide care coordination and submit referrals to community organizations or resources that may benefit the case and the family. Depending on the level of the child, that will dictate how soon a home visit will need to occur. So this is showing that timeline. And when the level gets dangerously high, we call these our urgent or emergency cases. When levels are this high, we always want to get a confirmatory venous blood test and do a home visit immediately so we can identify and remove the source as soon as possible. As soon as we're notified of the emergent level, we complete a home visit with the family the same day to get the lay of the land. We need to assess health status and symptoms, see if the child may have ingested a leaded object. And lastly, we want to make sure that we've provided the urgent education that testing is absolutely important so we can ensure the child's safety. We will also contact the healthcare provider to recommend for an expedited confirmatory venous blood test and recommend an abdominal x ray to check if the child did ingest a leaded object. Lastly, the family will, of course, get an environmental investigation as well. And due to the high level, it will be prioritized accordingly. In urgent and emergent cases, chelation therapy is something that may be taken into consideration, but with the consultation with a chelation field expert in order to best determine dosage and to determine if it's worth doing. We need to remember that chelation therapy is essentially the removal of metals from the body, specifically the bones and the soft tissues. But remember that our body has good metals too, so we need to outweigh our options. Typically, they say any level below 40, chelation isn't worth it. But levels above 40, it may be considered, but also with the consultation with a chelation expert. These are the chelation experts within our area. We have Dr. Allison Matsunaga of UCSF and Dr. Michael Jing of Lucille Packard's Children. For levels that are less than 40, our go-to recommendations for treatment are primarily to remove the source. But after that, provide nutritional support. And then lastly, consider prescribing iron supplements, while of course taking into consideration pre-existing health conditions. We want to encourage iron because iron and lead fight for the same receptors in the body. So the more iron intake there is, the higher probability of iron being absorbed versus the lead. Vitamin C, it enhances the absorption of iron, which is why we want to encourage more vitamin C rich foods. And then lastly, we want to encourage calcium, very similar to iron, where it's competing with lead for absorption. So the more calcium intake happening will lead to less lead absorption. And that is the end of my presentation. I do want to thank you all for being here with me today. And that is it.